For more reaction from the medical community now, let's bring in NBC News medical analyst Dr. Vin Gupta. Dr. Gupta, always great to see you. Let's start just with your reaction as a doctor to some of the claims from yesterday. Specifically, I want to talk related to vaccines and some other common medical treatments like antidepressants that were made by Health Secretary Kennedy yesterday. How would you characterize his views?
Well, Savannah, Joe, good morning. I'm taking this from an ICU on the West Coast, and so I've had a chance to confer with a lot of my colleagues in the medical community across the country. To a T, we all think it's dangerous and delusional, and I'm embarrassed for the Secretary of Health, and here's why. He's linking mRNA vaccine technology, Savannah, to the onset of the chronic disease epidemic, as though it happened just a few years ago, which is absurd. This has been something that's been at play for the last 80 years. It's getting worse. It's a real problem. We have to tackle it. It has nothing to do with vaccines. Antidepressants, he wants to link to mass shootings. There is no link between the two. It's laughable, but it's tragic because he's a leading health official. And it's distracting us from real, actual health problems here. But his views are not mainstream, but that misses the point. 79 medical societies have rebuked him. He does not have the trust or the respect of the people he needs the most to trust and respect him, and that's healthcare professionals.
We want to play a moment that maybe didn't get as much attention as some of the others, but it was between New Mexico Democratic Senator Ben Ray Lujan and Kennedy. He was asking Kennedy about this $50 million study that's trying to understand the possible causes of autism. Let's listen to that. We'll talk on the other side.
You said that you're soon going to release a study claiming to reveal the cause of autism. As you know, autism affects millions of children. So I guess you'd have the nation's top medical experts working on this. Mr. Kennedy, you hired a man named David Geyer to conduct this study. Is that correct?
No.
Is Mr. David Geyer working for HHS?
He's a contractor, but he's not conducting a study.
Is Mr. Geyer a doctor?
No.
Did you know he never went to medical school?
He's not practicing medicine.
Did you know that he got caught in Maryland and was charged for practicing medicine without a medical license?
He was charged by a medical board. He sued the medical board, and the medical board was found to have acted in actual malice and was fined $2.6 million by a judge in Maryland for doing that.
See, so you choose to know a lot when you want to know a lot.
So, Dr. Gupta, when you hear something that's someone with a medical background or yourself, what's the conclusion you draw?
Joe, this is symptomatic of everybody that is populating the upper ranks of the HHS. Whether it's leading this new autism research, or whether it's leading the FDA or the NIH. These are people that don't actually care for patients or pretend to, and they're making big decisions. And how can you have humility? Medicine is the art of, frankly, just operating. It's the art of medicine. There's some things we know. There's some things we have to use our judgment. But if you don't know and you are not a professional and trained in that space, how can you possibly make decisions that impact millions of people? He has charlatans in these positions. That just proved it, that discussion there. And of course, that's a continued source of worry.
Kennedy's revamped CDC vaccine panel is expected to meet on September 18th. It's coming up. What are the potential implications of that meeting for things like future access to vaccines, how insurance covers them? What is this meeting supposed to be for?
Well, Savannah, this meeting typically in most normal Democratic and Republican administrations, this meeting is meant to just issue typical standard recommendations from the Advisory Committee on Immunization Practices that then the CDC endorses. And then to your point, insurance companies then say, okay, we're going to cover that as we always cover it for patients across the country, depending on what insurance they have. Because there's an uncertainty now injected, this advisory committee has enormous power. They can say, we're not going to cover the COVID vaccine for certain age groups. That's going to have impacts on who has to pay money for it if they want to get it versus who doesn't have to pay money for it. Huge impacts. By the way, pharmacists across the country, most Americans actually get their vaccines at pharmacies across the country. Pharmacists cannot do something that this advisory committee does not endorse because there's strict rules there in terms of their scope of practice. So the pharmacists down the street, Savannah, may not be able to do what they typically do based on what this advisory committee says. People will probably have to pay out of pocket that usually did not have to for these vaccines. And I'll just say, they've signaled, Senator Rand Paul, others at HHS have signaled perhaps hepatitis B vaccine might be next for reasons, I have no clue. There's no scientific reason why we would be revisiting hepatitis B vaccine for a pediatric population. No other country in the world is doing this. Here we are having these types of conversations.
Dr. Gupta, thank you very much. Your expertise appreciated this morning.